Friends, I am Dr. Surajit Ghosh. Welcome to my channel, Dr. Ghosh Presents. Top 12 Homeopathic Remedies for Piles or Hemorrhoids. Hemorrhoids spelling H-A-E or H-E, both will do. What is piles or hemorrhoids? A massive venous plexus is formed at the end of human alimentary canal where anus and rectum meet due to anastomosis of systemic veins and portal vein. The place is here. This is the place of anastomosis of two types of vein, systemic vein and portal vein. Owing to diseased state of plexus, veins of the side get swollen, enlarged and often rupture to bleed, which cause inflammation, soreness and tenderness of the place. Actually, these swollen inflamed veins are called piles, hemorrhoid, varices. From outside with naked eye, this appears as globular pieces of skin-like tissues, like this, small skin-like tissues of various sizes. Mind it, this is the rectum. The rectum ends here. Now this is anus. This is opening of the alimentary canal down where the stool passed. Rectum and anus are two separate anatomical places. This should be kept in mind because during description various time rectum and anus will come. What are the types of piles and how many persons suffer from piles? Piles are of two types: internal, external. These are all internal piles, and this is external, this is external, this is external, which is seen from outside. Which is not seen from outside, lying inside the anal canal, it is called internal. Internal piles are formed in the upper part of rectum and extend downwards the open ends of the anus. Depending on the length, they were maybe of four types: first degree, second degree, third degree and fourth degree. External piles originate towards the lower end of the anal canal and extends beyond anus. About 1 in every 20% in the world suffers from this disease during his or her lifetime. Please remember this. This is a very, very common disease in the world. What are the causes of piles? Modern books of medicine says that the following are the reasons of piles. Number 1, due to long suffering of diarrhea, dysentery or constipation. Number 2, due to weakness of rectum at late age. Number 3, from long continuing cough. Number 4, due to heavy weightlifting or for long time. Number 5, owing to pregnancy. Number 6, from familial reasons. Number 7, for being obese. But I slightly differ. From my experience as a physician, I personally think piles cannot form without damage of liver cells. Damaged liver cells cause congestion in the portal vein, which results in the formation of piles. Exclusively my own view. On the right hand side, this picture is shown. This is the liver, and there is lying the anastomosis between the systemic vein and portal vein. When there is congestion in the portal vein, the blood cannot pass from this to this liver easily. So there is a back pressure, and due to that back pressure, the veins swollen and piles result. This is my own view, but book says these are the causes of piles. What are symptoms of piles? Number 1, frank bleeding prior to, during or after evacuation of stool. Number 2, sensation as if something is stuck in the rectum. Number 3, secretion of thick viscid mucus from anus, which often soils undergarment. Number 4, uneasiness in anus as if it is full of something. Sensation of stool remaining in the rectum after evacuation, or there are pins and needles or fine nails in the anus. Number 5, itching, pain, tenderness in the rectum. Number 6, during ablution, often feeling of painless hemorrhoidal mass in hand. Number 7, sometimes hemorrhoidal mass again goes back into the rectum, sometimes it remains outside. How to prevent piles? Avoid. You should avoid all these things if you want to prevent piles. All substance of addiction, all foods made of trans fat, taking of aspirin, acetaminophen, groups of drugs over a long period. You should avoid this thing actually. Now for pesticides, adulterated oils, spices, colored drinks, foods with preservatives. Number 5, taking too much of sugar, salt, saturated fat, canned food or drinks, ready foods of meat, etc. This everything should be avoided. Take daily, that is, you take daily this thing. Number 1, enough fresh veggies, fruits, salads. Number 2, at least 2 liters of water. Number 3, regular physical exercise so that a few drops of sweat come out. This is a very important point, mind it. 3 stars. If fruits are taken with staple food regularly, that is staple food means with as Indian with rice or chapati or rotis, more benefit are expected. That is, if you eat fruits separately, you will get certainly benefit. But if you get food mixing with staple food, then more benefit will come of it. Now the medicines. The remedies actually. Homeopathic remedies. Zinc made for piles. Constipation. Stool only discharge after hard pressing. Violent itching. Soreness at anus. Tingling sensation as if from worms. Violent desire to urinate. Worse in afternoon and evening. In warm room. Better in open air. Thuja for piles. Violent pain during stool. So much that one stops trying evacuation. During walking, intense burning feeling, and sore, fissured, what's around, bruised feeling in sacral region. The sacral region, I have shown the sacral region. The sacral region actually, this is the pine bone. From here, cervical, then thoracic, then lumbar, then sacral. This is the sacral region or sacrum vertebra. There are 4 or 5 pieces of sacrum vertebra here. Calculated floor for piles. Constipation with dull headache and dizziness. Piles bleeds. Tired aching in smaller back. Smaller back actually lumbar 5th vertebra level. I will show you the picture immediately. Anus itches. Campy knotting in the calves of leg with severe pain and visible enlarged veins. Look at the image on the right hand side. This is the L5 region or smaller back where the lumbar vertebra just finishes and the curvature starts. That is the L5. These are the campy knotting in calves with severe pain and enlarged veins. Calicut for piles. Distress feeling an hour or 2 before stool. Sensation as if a red hot poker were thrust upon the rectum. Better sitting in cold water. Stinging, burning, itching, tearing even after natural stool. Piles complicated with fistula any, especially in persons suffering from lung troubles. Nitric acid for piles. Following loose motions, long-lasting cutting pain in rectum with hemorrhoidal problems. Old pendulous, non-bleeding but painful to touch, especially in warm weather. Hemorrhage bright red that doesn't coagulate easily. Bleeding after each stool, fainting from least motion. Spasmodic tearing during stool with fissures in rectum. Actually, fissures in rectum better to see fissure in any. Hematuria with shuddering along the spine during micturition. Millefolium for piles. Piles with profuse flow of blood. Chronic blenuria. Blenuria means the secretion of mucus from atony of mucous membrane with great pain. Silesia for piles. Intensely painful hemorrhoids. Boring, cramping pain from anus to rectum and testicles. Protrude during stool, become incarcerated. Incarcerated means the particular mass of hemorrhoidal mass actually that becomes non-returnable, that is remains outside. Generally, to start with, the pile mass comes out during stool and goes back naturally into the rectum. This is natural, but gradually it becomes incarcerated, that is, it doesn't return. And suppurate. Piles protrude with stool and discharge bloody mucus. Can be pushed back with difficulty since it is already incarcerated. Fistula in ano with chest symptom. This is a very important symptom, mind it. Whenever you will come across this symptom, there is fistula in ano and patient suffering from chest problem. Silicea is one of the top medicine there. There are other medicine also, I will come. Aching, beating, throbbing in lumbosacral region. Lumbosacral region means lumbar and sacrum, junction of the lumbosacral. This lumbosacral region. Anus is constantly damp. The silicea patient requires silicea. That patient requires silicea, which anus is constantly damp. Always oozing something from piles. And that patient may possibly requires a dose of silicea 200, and 200 silicea will act for several months. Please rewind this. 200 silicea will act for several months. Don't interfere with the action. The disease will aggravate, then ameliorate, symptom will change. That is, medicine is acting. It may take 5, 6, 7 months, and ultimately that one dose will cure. Sulfur for piles, secreting dark blood and altogether blind piles with much bearing down pain from smaller back towards anus. Smaller back, already have discussed the L5 region. After stool, lancinatic pain from anus upward stopping the breath. Suppressed piles with colic, palpitations, congestion of lungs, stiff, bruised back, anus swollen with sore stitching pains, considerable blood passed with soft easy stool. Mind this, considerable blood passed with soft easy stool, painless pile. The sulfur actually covers 3 different types of piles. Blind piles, there is no bleeding from piles. Painless piles, there is piles but there is no pain. Suppressed piles, the piles has been suppressed, some new disease has come, there also sulfur will come. The 3 different types of piles can be covered in sulfur. Netamure for piles. Varices humid. Varices means actually the hemorrhoidal tumors. Stinging and painful, protrusion of rectum with smarting and burning sensation. Herpes on the boundaries of the hair of the nape of the neck. Herpes about the anus. Stool hard, difficult, crumbling. Anus contracted, torn, bleeding, smarting, burning afterwards. Stitches in rectum, cutting pain in urethra after micturition. Tongue mat, picture 1, or tongue moist with raised papillae, number 2. I will describe the picture very soon, particularly these 2 types, nape of the neck. Muriatic acid for piles, sudden appearance of piles in children. Piles of women after confinement. Hemorrhoidal mass inflamed, swollen, bluish with swelling of anus. Sore pains, violent stitches and great sensitivity to contract, even to use of tissue after stool. That is, when tissue paper is used, that touch of tissue paper also gives trouble. Prolapsus ani while urinating. Prolapsus ani while urinating. This is the picture of nape of the neck. Mind this is the area is called nape of the neck. Just below the hairline, the back, the neck. Scholarship for piles. Hemorrhoids, bleeding or blind. Blind means blind, that is no bleeding, with feeling of dryness in rectum, as if little sticks or splinters were pricking there, weak feeling at sacroiliac symphysis means joints, as if the legs were to give out, worse from stooping or walking, aching between shoulders. Pain shoots up the rectum from hemorrhoidal tumors with lameness and aching in back, purple piles. Patient depressed, irritable, suffering from abdominal plethora, throbbing deep in the abdomen, particularly in hypogastric region. Note this, the whole abdomen has been divided into 9 parts. You please read out the name of the parts. This is called hypogastric region. Other, the names are clearly given. You please read this. It's very important for if you want to learn medicine really, then you must know the 9 names. and where it locates. Arsenic alpha piles. Piles bluish, swollen, protruding, bunched, which bleed from least touch with stitching, burning pain when walking or standing, but not at stool. Not during stool, but when walking or standing. Burning. Soreness in rectum and as worse at night from cold, from ice water, ice cream in hot weather. Better from warmth. Piles of drunkard, patient restless and very weak. Patient restless, very weak, it is the general symptoms of arsenicum. All arsenic patients are very much restless, they feel very weak, and they have also fear of death. They think that they are going to die, the medicine will not work on them. This is arsenic pictures. With this, the video ends. Please, if you fall any problem, write down in the comment section. I will reply. Thanks for listening and viewing.